punched out retinal lesions. Now there's a lot of confusion here in the options. First of all, please check if the options are correct, and also tell me, was the question is that it is seen in, or was the question not seen in? Because I'm really doubting that they asked it is not seen in, because only one of the options per se here is actually showing you the punched out retinal lesion. So Swaroop, Vandana, Sakshi, what all those people who are watching me, please tell me, did they ask it is found in or it is not found in? Because if you look at the options, I think options it will be resumed. It will be resumed soon. I think today and tomorrow we are doing the recall, and then we will be resuming the questions. Okay. It is seen in, because I really देखो अभी भी there is a mixed response कि it is seen in and it is not seen in, क्योंकि ना out of these only one option shows punched out lesions, and that is the toxoplasmosis. Only the one option. So I do not know how, if they have given not seen in, then how they have given, because posterior staphyloma definitely is not showing you the punched out lesion. Posterior staphyloma is the posterior ectasia. Posterior ectasia of the sclera that you get in cases of the high myopia. 100% है not seen in. तो I do not know. अगर not seen in है, then you have to go with the odd one out, क्योंकि posterior staphyloma, ideally speaking, is not a punched out lesion. Punched out lesion C is something like this. This is your toxoplasmosis. So this is the one that typically is called as the punched out lesion. So when you call it as a punched out lesion, it's a chorioretinal lesion which is having the what you call as the they asked not seen in. So okay, let's do it both ways. Punched out lesions may you are getting the punched out lesion as the chorioretinitis. Chorioretinitis. So see, punched out lesions is a definite term which is used for a series of the lesions where they are found the defects in the RPE level, choroid and the retina. So basically this is found out of these four options. It is actually found in the toxoplasmosis. Posterior staphyloma में what you are getting is the stretching of the eyeball, है ना जो हमें मिल रहा है. This is the posterior stretching of the eyeball. This is called as posterior staphyloma that you get in the cases of high myopia or the pathological myopia. So ideally this is there. If I talk about the coloboma, now coloboma means you will get a round kind of a lesion where you will have absence of the tissue. Coloboma means you will have absence of the tissue. So that is also not called as a punched out lesion. When I talk about the rubella retinopathy, then this is typically a salt and pepper retinitis. Salt and pepper retinitis. And in the cases of toxoplasmosis, you will have typically headlight in the fog appearance. Headlight in the fog appearance. So this headlight in the fog appearance, basically what you are having here, this headlight is a patch of the chorioretinitis. This is a patch of chorioretinitis, and what fog is actually the vitritis. So this patch of chorioretinitis is actually a punched out lesion. So ideally what they should have asked is that it is found in, out of this it is found in the toxoplasmosis. Nevertheless, because even in the rubella also we do not get the punched out lesions. We get the salt and pepper retinitis, or we get the micro ophthalmos micro-ophthalmos also we are getting, and then we get a cataract, the nuclear pearly cataract. The nuclear pearly cataract. So the kind of lesion what you are getting in retina is a salt and pepper retinitis. So according to me, the answer should be toxoplasmosis. If they have asked, it is found in. Now see the other things also. Basically, the most important cause where you get this punched out lesion is the presumed ocular histoplasmosis syndrome. We have to learn for the future, because this is not something which is usually asked and we are usually covering. So this is actually a presumed, that is your POHNS, presumed ocular histoplasmosis syndrome. There you are getting a very typical, this one typical punched out lesion. So apart from the toxoplasmosis, another cause where you get a punched out lesion is your presumed ocular histoplasmosis syndrome. This is one. Then you have got wherever you are having the patch of chorioretinitis. So another is your tuberculosis, where you are having the posterior uveitis, granulomatous uveitis. So toxoplasmosis bhi hai, histoplasmosis hai, tuberculosis, sarcoidosis, see, syphilis. These are the things where you are getting these kind of lesions. Even they are also including the sympathetic ophthalmitis. So sympathetic ophthalmitis, again, it's a traumatic type of uveitis, but that is also a granulomatous uveitis. There also you can get it. Then a very important thing, you are having the two more short forms. You are having the MEWDS. This is your multiple evanescent white dot syndrome, the birdshot chorioretinopathy जिसमें मिलता है, very small lesions. There is also there. So you should know the full form now, multiple evanescent white dot syndrome. There you can again have. And another is your AMPEE. AMPEE. That is also there. This is your acute posterior multifocal placoid pigment epitheliopathy. Now, we will not go into the details because this is a far beyond level of PG, but you can learn the names at least. Where you can have the punched out lesions. Only learn the names where you can have. Yeah. Actually, what happens now, the problem is when they give you the very close options or very absurd options. So question is not a problem. Some people are saying that it is found in, we are 100% sure, and some people are saying that it was not found in, we are 100% sure. So I cannot say about it. Obviously, you people have attempted it, and you people are right, whatever you are saying. But the thing is that we have to understand the concept, that if it comes in future, how you have to attempt it. So if it is found in out of these options, the answer will be toxoplasmosis. है ना. उसके अलावा wherever you are having the granulomatous uveitis, you will find it. And one more thing where you can get this punched out lesion is your tuberous sclerosis. That is called as the tuberous sclerosis complex. That is called as the tuberous sclerosis complex. So for the future, you can learn these names. We have histoplasmosis, toxoplasmosis, sarcoidosis, syphilis, tuberculosis. Then we have got the multiple evanescent white dot syndrome. We have got the acute multifocal placoid pigment syndrome, and then we have tuberous sclerosis complex. These are the places where you can get punched out lesions.